My name is Shalini Arunogiri. My role is as Clinical Director of the Hamilton Centre and Turning Point Statewide Services, and my research work involves being Associate Professor and Head of our Clinical Trials and Novel Interventions treatment team. So Turning Point Statewide Services is a range of addiction treatment options that exist for clients across the state. Our clinic's based here in Richmond, and we see people face-to-face or by telehealth from all walks of life and across the state of Victoria. We've got clients actually drive in 2.5 hours to see us sometimes. So it's a great opportunity to actually understand what's happening across the state. And our program involves outpatient treatment, it involves a care for opioid use disorders, it involves kind of addiction specialist treatments, neuropsychological, psychological treatment programs as well. So the Hamilton Centre came out of the Royal Commission into Victoria's mental health services. And I think across the Royal Commission, what we really saw was that the Royal Commission was informed by people's lived experience, so individuals and families, and what their experience as the frontline service delivery was across the state. And the Hamilton Centre, the crux of it is really about hearing, I think, from people and families that people living with integrated problems, so thinking about co-occurring mental health and addiction problems, weren't being able to get the care that they needed where they were accessing care and support. So the Hamilton Centre's initiative and purpose is really about stitching up systems. It's about stitching up services so that they're going to work for people wherever they are, so they can get the care that they need. And these problems are not unique to Victoria, they're not unique to Australia, in fact. So some of the work that we do, both in training and research, really has the capacity to inform sort of system change across the country and internationally. So over the next 6 to 12 months, we're really excited about a range of work that the Hamilton Centre is getting to do. We're moving into the sort of second phase of the Royal Commission into mental health services, and what that means for us is that we get to start to think about how services are sort of maturing and become established. That includes the local mental health and wellbeing services that have been stood up across the state. And so our Hamilton Centre team gets to work in a training and research portfolio as well as clinical service delivery. And some of the research and training that we're doing is about transforming kind of on-the-ground service delivery, particularly for these new tranche of services such as the locals. So we're getting to work across the state on that, and that includes over the next couple of months, we've got some roadshows across the state. Our next kind of training workshops are up in Mildura in July. So our team's going to get up there and get into it.